Hi there, my name is Katie Herter, and today I'll be presenting on my Global Health Institute Scholars experience in Ireland, working on Project Insight GP at the University of Limerick. So a little bit about myself. I'm currently a third-year PhD biostatistics student in the Mel and Enid Zuckerman College of Public Health. I'm also a research associate with the University of Arizona Health Sciences Comprehensive Pain and Addiction Center. Before starting my PhD, I earned my MPH also here at the University of Arizona with a concentration in biostatistics. I achieved my bachelor's degree at the University of California, Santa Cruz with a major in psychology and a minor in biology. I'm also a returned U.S. Peace Corps volunteer, and I was a Paul D. Coverdell Fellow here at the University of Arizona. So I'll first tell you a little bit about my site. This summer, as a Global Health Institute scholar, I was in Ireland, and I was working at the University of Limerick. Established in 1972, the University of Limerick is one of Ireland's first modern universities designed to meet the growing educational and research needs of a rapidly developing Ireland. I worked in the School of Medicine, specifically in this building, pictured here on the left, which is home to the public health program along with other health-related disciplines, contributing to the university's mission of advancing healthcare education and research. So the UL campus is set along the banks of the River Shannon and is known for its scenic beauty with plenty of green spaces, lakes, and riverside walkways. You can see just how brilliantly green it can get on a nice sunny day, which can be rare, but I got to capture in these photos here on the right. Some fun facts, UL is home to the longest pedestrian bridge in Ireland called the Living Bridge, which spans the River Shannon. And it is also home to Ireland's first Olympic-sized swimming pool. Now there are two others. They have a really nice sports facility, which I got to take advantage of during my stay. So the UL campus is located in Castletroy, which is just outside the city of Limerick, which is one of the oldest cities in Ireland. It has a rich history with medieval architecture, including King John's Castle, which dates back to the 13th century and is pictured here on the bottom left. It is also the setting of Frank McCourt's renowned Pulitzer Prize-winning memoir, Angela's Ashes, and birthplace of the iconic rock band, the Cranberries. It's also home to Thomond Park, the stadium of Munster Rugby, one of Ireland's most successful rugby teams. I got to see the last game held at the park for the season in June, which is photoed right here. So Limerick City and the University of Limerick, as I mentioned, lie on the River Shannon, which is the natural border between County Clare and County Limerick. And there are lovely trails on campus along the river for running, cycling, or even beaching, as you can see in this photo I took here. So I'll talk a little bit about my team. So my supervisors and the principal investigators on the project were Dr. Peter Hayes and Dr. Patrick O'Donnell. So Peter is here on this picture on the left, second to the right. Fortunately, Patrick was not there on the day that I came to take pictures. Both are general practitioners and professors at the School of Medicine. They're both really awesome guys to work with, super caring and passionate about the work they do. I primarily worked with my friend and colleague Alex, pictured here, furthest to the right on the photo on the left, a medical student involved in the project. The atmosphere at the School of Medicine was really fantastic, and during my stay, I had the opportunity to meet many amazing researchers, professors, and graduate students, and everyone was really friendly to me. It was very common to take an hour coffee for lunch as coffee break before lunch, as pictured here. All right, so I will now talk a bit about my project. So the original broad purpose of this study, Insight GP, Inquiry into Service Usage, Gerontological Health and Multimorbidity in General Practice, was to provide a comprehensive cross-sectional analysis of the health of individuals over the age of 70 by examining retrospective data from electric files in 14 general Irish practices to enhance the management of individuals dealing with multimorbidity. So what I specifically worked on was expanding this research to investigate healthcare usage among Ukrainian refugees. In the Midwest of Ireland, including County Limerick and County Clare, approximately 8,000 patients rely on a health service executive provided Ukrainian response clinic for general practice with many over 7 years old experiencing multimorbidity. Ukrainian patients face additional challenges due to limited English proficiency in navigating a new and complex healthcare system. So, our three goals of the specific manuscript we're working on were to compare demographic characteristics such as age and sex distribution between the Irish and Ukrainian cohorts, and also assess primary care utilization patterns by examining the frequency and types of interactions with primary care providers and outpatient services and hospital admissions. We also wanted to evaluate the completeness and robustness of the available medical data, including key health indicators like morbidity diagnoses, medication use, and clinical measurements. When I arrived in Limerick, the project was still in the data collection phase. So in Ireland, there is no unified electronic health record system across practices. So we needed to manually extract data from medical records. Much of my time was spent helping transferring this data into spreadsheets. We could access the Ukrainian data remotely from campus, as Patrick had access from his computer. But for the last remaining Irish site, we had to visit the clinic to retrieve the data. Due to strict ethical protocols in Ireland, I couldn't assist with this step directly as I wasn't allowed to view the files. However, I accompanied Alex to the clinic in Corofin, which is a very charming town near the Burin National Park and close to the beach in Lahinch. And this is in County Clare, which is neighboring to County Limerick, the other side of the River Shannon. And so here's Burin National Park, which is famous for all the limestone, and Lahinch Beach on the bottom left there. And then here's the actual clinic in Corfin on the top left, and then Alex doing some work and posing by the sign for Burin Medical Center. We are still working on the manuscript and completing our results and discussion, but I can provide some general outcomes that we've found. So far what we're seeing is that the Ukrainian sample is younger and higher percentage of women compared to our Irish cohort. Overall, there were more visits of all types among the Irish patients compared to the Ukrainians. There was a higher rate of multimorbidity, which again we defined as having two or more morbidities, and also polypharmacy, which is being prescribed five or more pharmaceuticals among the Irish compared to the Ukrainians. And so something to note is that the multimorbidity rates were closer between the groups, while the polypharmacy gap was wider. And so Ukrainians might not be getting prescriptions for morbidities as often as Irish, and they also may be underdiagnosed considering they are seeing their GP less frequently. We also found there was greater amounts of chart missingness in the Ukrainian sample, which could affect these morbidity rates and prescription data that we are seeing from our data. So it seems that there might be some challenges getting these Ukrainian patients all the care they need, is what we are understanding from the data that we're looking at. And so it's been really interesting and rewarding project to work on. And then we hope that providing insights into the healthcare needs of this vulnerable population facing multiple challenges, we can identify gaps in service provision and areas for improvement to enhance the quality of care for these Ukrainian refugees. We also hope this research will contribute to more effective healthcare policy planning and guiding government strategies to allocate resources, implement tailored interventions, and develop comprehensive support systems that meet the specific needs of these Ukrainian patients, ultimately leading to better health outcomes and increased equity in healthcare access. So now I'll just reflect on some of my final takeaways. What is my final takeaway of my experience this summer? I'm very lucky and Ireland is awesome. I feel so grateful that I got this opportunity to learn about Irish culture, learn more about their healthcare system. And also, I just met so many amazing people and had so many amazing experiences. Ireland is a beautiful country, and I really took advantage of my time there and tried to see as much as I could. So I will finish this presentation off with a few photos, like Giant's Causeway here in Northern Ireland. This is County Kerry on the right there. I got to go to Belfast. There's a great traditional music scene, the Cliffs of Moher, County Donegal, and again, this is another photo from County Kerry, but beautiful beaches on a sunny day. they are as nice as beaches I've seen in the Caribbean. So with that, I want to say thank you for listening to my presentation. And again, I really had an incredible experience, and I could not recommend becoming participating in this Global Health Scholars program to any other graduate student or undergraduate. So thank you so much.